Severity of endoscopically identified esophageal rings correlates with reduced esophageal distensibility in eosinophilic esophagitis. Introduction. Eosinophilic esophagitis, EOE, is a clinico-pathologic disease characterized by esophageal dysfunction and eosinophil predominant inflammation in the esophagus. In recent years, EOE has become increasingly recognized as a leading cause of dysphagia and food impaction in the adult population. The clinical manifestations of EOE in adults are attributed to esophageal luminal narrowing, which results from the remodeling effects of chronic inflammation. Evidence for esophageal remodeling in EOE includes histologic demonstration of epithelial expansion, subepithelial fibrosis, and angiogenesis, as well as macroscopic demonstration of esophageal strictures and increased thickness of the esophageal mucosa, submucosa, and muscularis propria. The high degree of effectiveness of esophageal dilation in providing long-lasting relief of dysphagia in adults with EOE, despite the persistence of inflammation, highlights the central importance of tissue remodeling in symptom generation. However, as opposed to inflammation, which can be evaluated by histopathology, there are currently no validated biomarkers to measure the degree of tissue remodeling and fibrosis in EOE. Standard endoscopic biopsies assess the remodeling changes in the epithelial space, but are adequate to evaluate the presence of subepithelial fibrosis in only a minority of cases. One potential means for assessing disease activity that provides information for esophageal remodeling is endoscopic imaging. Characteristic esophageal abnormalities evident on endoscopy in EOE include edema, loss of vascular markings, rings, trachealization, exudates, white plaques, longitudinal furrows, vertical lines, and strictures. However, assessment of the endoscopic findings of EOE can be quite subjective. A recent meta-analysis by Thieme et al., which included 100 articles on the endoscopic findings of EOE, found significant heterogeneity among publications in endoscopic descriptions. While the overall level of sensitivity of endoscopy for EOE was modest, prospective studies have reported higher sensitivities exceeding 90%. The lack of a unified nomenclature for describing the endoscopic features of EOE presents a major limitation in endoscopic assessment of disease severity. Recently, Chen et al. Proposed a classification system for endoscopic evaluation of EOE, EREFS, in which the endoscopic features of EOE, edema, rings, exudates, furrows, and strictures, were systematically graded. Intra- and inter-observer agreement using EREFS has been independently validated by U.S. and European investigators. Endoscopic features measured by EREFS are a major determinant of overall disease severity judged by gastroenterologists and are associated with symptom severity using a recently validated patient-reported outcome instrument for EOE. The endoluminal functional luminal imaging probe, EndoFLIP, also known as FLIP, is a novel technology that utilizes high-resolution impedance planimetry to evaluate distensibility within a hollow organ. The FLIP device provides data on cross-sectional area, CSA, at multiple sites along the probe while measuring intraluminal pressure during controlled volume distensions of an infinitely compliant bag. The pressure-volume relationships generated allow both the compliance and distensibility of a hollow organ to be determined. FLIP technology has been used in the esophagus to assess esophagogastric junction, EGJ, distensibility in gastroesophageal reflux disease, GERD, and in treated and untreated achalasia patients. The author's previous study demonstrated a substantial reduction in esophageal distensibility in adults with EOE compared with controls that was independent of the degree of esophageal eosinophilia. The quantification of stiffness of the esophageal wall by FLIP provides an objective measure of tissue remodeling at the whole organ level. The aim of this study was to evaluate the association between endoscopic severity in EOE patients, as graded with the EREFS system, and esophageal distensibility, as measured by FLIP. Background and study aims. A grading system for the endoscopic features of eosinophilic esophagitis, EOE, has recently been validated. The EOE Endoscopic Reference Score, EREFS, incorporates both inflammatory and remodeling features of EOE. High-resolution impedance planimetry using the functional luminal imaging probe, FLIP, is a technique for quantification of esophageal remodeling. The aim of this study was to evaluate the association between endoscopic severity with ER-EFS and esophageal distensibility as measured with the FLIP. Methods: upper gastrointestinal endoscopy with biopsies and FLIP were performed in 72 adults with EOE. Endoscopic features of edema, rings, exudates, furrows, and stricture were evaluated using the ER-EFS system. Esophageal distensibility metrics obtained by FLIP, including the distensibility slope and distensibility plateau, were compared with ER-EFS parameters. Bivariate associations between ER-EFS parameters and histologic eosinophil density were assessed. Results: higher ring scores were associated with a lower distensibility plateau. An association was found between severity of exudates and eosinophil density, as well as between furrows and eosinophil density. Severity of exudates and furrows and degree of eosinophilia were not associated with the distensibility parameters. Conclusion: endoscopic assessment of ring severity can serve as a marker for esophageal remodeling and may be useful for food impaction risk stratification in EOE. Eosinophil count was not significantly associated with esophageal distensibility, consistent with previous reports of dissociation between inflammatory activity and fibrostenosis in EOE. Endoscopic inflammatory features show a weak correlation with histopathology, but should not replace histologic indices of inflammation.